Welcome everyone to the Canadian Diabetes Association's 2016 webinar series. My name is Farah Ismail and I will be your host for today. We are delighted that you're able to join us today for the webinar to learn about managing your medications. Now to start us off, I'd like to draw your attention to our survey. It's located at the top right-hand section of your screen. In order to better serve your needs, we kindly ask you provide us with your input by completing the short survey towards the end of the presentation. And we thank you in advance for your input. Throughout the presentation, you will have the opportunity to type in the question and answer box. That's located at the bottom right-hand section of your screen. And we ask that you use this for any questions you have along the way, and our presenter will be happy to answer them at the end of the presentation. As well, we will be displaying a few polling questions throughout the presentation and would love for your participation in these questions. Please note that your answers are completely anonymous. Also note that you're able to customize your screens to expand and collapse them as you see fit, so please feel free to adjust them as needed by dragging down the bottom right-hand corner of each of the webinar pods. Our presentation today will last about 30 to 40 minutes in length, and we'll have about another 10 to 15 minutes at the end for questions. It is important to note that our presentation is recorded and will be available on our CDA website at a later date. So now I'd like to welcome our speaker, Freda Leung, and thank her for joining us today. But before turning it over to Freda, I'd like to give you a brief introduction. Freda is a clinical consultant pharmacist specializing in diabetes and geriatric medication management. Her professional activities include providing consultation to long-term care homes and pharmacist groups on diabetes management, teaching continuing education programs at the Ontario Pharmacists Association, and speaking on topics related to diabetes, geriatric medications, and health behavior changes. For more information on Freda, please read the speaker bio section, which is located to the left of your screen. So, without further ado, I present to you Freda Leung.
Welcome everyone to the webinar on minding your medications. Most people living with chronic health conditions have to take several or many medications as part of their treatment. As the number of their medications increases, so is the risk of not managing them. So the following is the framework for this webinar discussion. Understand barriers of managing medication. Understand medication mismanagement and know the impact. Learn tips to manage medications well. And lastly, identify support available to better manage medications. So before I start reviewing the slides, let's do a polling question. Do you or someone you support have difficulty managing their medications, such resulted in missing doses or doses not taken incorrectly? So if you can indicate your answer, and we'll discuss it in a few minutes. So please click yes or no and then submit the answer, and then we'll have the results in a very short time. As I see from the response, half of the people said, a little more than half of the people said yes, either themselves or the people they support have difficulty managing the medication resulted in missing doses or doses taken incorrectly. And great for about 44% of the people that are watching the webinar that they did not have trouble. That's great. So let's focus on the population that are experiencing difficulty in managing their medications. Okay. Let's meet our patient, Anna. Let's look at our patient, Anna, to see what challenges she has in managing her medications and see what we can learn from her situation. Anna has several chronic health conditions, and they're listed below, and we'll go through them. But her list is not exceptionally long. So let's learn something about Anna. She is 69 years old. She is widowed since last year, and she lives with her daughter and the daughter's family. Her past medical history is she has type 2 diabetes, high blood pressure, high cholesterol, and she has COPD, which is chronic obstructive pulmonary disease. She had a history of breast cancer, but is in remission. She is also diagnosed with osteoporosis, depression, and hypothyroidism. So, what medication does Anna have to take and how many? Let's take a look. To manage her chronic health conditions, she has to take 3 pills for her diabetes every day, 3 types of pills, and 3 types of pills for her high blood pressure. 1 type of pill for her high cholesterol. And she needs to use 3 inhalers for her COPD. Out of that, 2 of them she has to use regularly, and 1 is as needed. And she takes 1 type of medication for breast cancer maintenance, 1 medication weekly, plus 2 calcium supplements every day for her osteoporosis. 1 medication for her depression, 1 medication to suppress acid secretion, and 1 medication for hypothyroidism. Her list of medications seems long and multiple doses need to be taken, but for my clinical practice, yes, that is a very common scenario in people with several chronic health conditions. And we asked Anna, how do you take your medication? And this is what she states, that she takes her medication as such every day. So for the 3 diabetes pills, she spread them out, take them some before breakfast, some before lunch, some before supper, and another one before bedtime. For the blood pressure med, she did the same because she believes spreading them out is better to avoid drug interactions. So, in summary, Anna takes 1 pill before breakfast every day, and on 1 day of the week, another pill for her osteoporosis. And at breakfast, she takes a total of 6 pills and 2 puffs of 1 puffer. At lunch, 5 pills and 1 puff of the other puffer. At supper, 3 pills, and at bedtime, 5 pills and 2 puffs of 1 puffer. In total, she takes almost 20 tablets every day. So, how is Anna managing her medication? Well, let's see. She went to her doctor for the annual checkup, and she was called to return to the office to discuss the results. At the checkup, the doctor also noted her blood pressure, her diabetes, and cholesterol are all above target. That means they are not being managed well. Anna also told the doctor that she has some symptoms: constant dull headache, low mood, and she's often short of breath, even climbing up a few steps of the staircase. Let's go to our next polling question. Do you think Anna's abnormal lab results is attributed to not taking her medications as prescribed? Please indicate your answer and we'll look at the results. Most of you think that her symptoms or abnormal results are related to her not taking medication correctly. Well, I do agree. Let's go to the next question. What about her other symptoms, like low mood, short of breath, or dull headache every day? Are they related to medication mismanagement? Please indicate your response. Yes. Majority of you indicated yes, they are related to medication mismanagement, and this is often the case. The doctor has the best intention of prescribing all the medication that the patient needs for their chronic health conditions, but if they're not being taken properly, then they could be not well managed, or other symptoms come up that the patient is not enjoying good health. So let's look at how common is medication not being taken as prescribed. Is Anna the only one, or there's many others out there? In fact, studies have proven that medication prescriptions, from 20 to 30% of them, have not even been filled. So never mind taking them. They haven't even been filled when the prescription is written. And medication not continue as prescribed in about 50% of the cases. The common medications are those that manage chronic health conditions, such as high blood pressure. And also rates of medication adherence dropped after the first 6 months. For example, 25 to 50% of patients discontinue statins, which is a common medication to manage high cholesterol. That is discontinued within 1 year of treatment initiation. So Anna's not alone. So if that's so common, people are not managing their medications or discontinue them prematurely, what are some of the reasons for medication non-adherence? Look at the reason there and check any one of those, or if you identify more than one reason, check them all. And we'll look at the results in a few minutes. Yes, all those reasons can contribute to medication mismanagement. So let's come back to Anna. What can we learn from her situation? Well, when we dive deeper into how she manages her medication, Anna admitted that she stopped taking one of the 3 blood pressure medications 6 months ago because she dislikes taking so many medications. We often hear patients that, I don't want to depend on the medication for the rest of my life. How am I taking so many? So she also believes that, so she stopped one of the 3 blood pressure medications. And she took half of the dose of the 2 diabetes medications because one morning she felt dizzy after taking them. So she experienced some unpleasant side effect from taking the medication. That was the reason that she discontinued that one or reduced the dose. And for her COPD, she used a blue puffer, which is a reliever, when she's out of breath. The other 2 puffers that she's supposed to use every day, she didn't use them because she figured, well, when I used them, I didn't get immediate relief. The blue puffer is the one that I needed, so that's what she used. And she also have stopped taking medication for her depression after starting for 2 weeks because she didn't notice any symptom improvement. And therefore, she doesn't think the medication helps her. For the lunch dose, she often forgot to take it. And for the medication she needs to take once a week, that medication needs to be taken on empty stomach and remain upright for 30 minutes. She often forgot. By the time she come around to take that, she already had breakfast. So she takes the medication after her breakfast. Well, what does that result in? We can see from her office visit at the physician's office that her blood pressure is above target, is not managed. Her A1C is above target. That means her diabetes is not well managed. She's short of breath, even climbing a few steps. And she has low energy, needless to say, if you're short of breath. And she has low mood because her depression is not managed. And also coming back to the uncontrolled high blood pressure, one of the symptoms could be a dull headache, and she was experiencing that as well. What about her osteoporosis? She's taking the medication not at the optimum time. She's not getting the benefit from the medication to take once weekly. So therefore, her osteoporosis is not well managed either. She's at a high risk of fall, and if she does fall, then she can be at a high risk of fracture. So let's step back and look at Anna's one of the many patients that are not managing their medications well. But what are really some of the common reasons leading to medication mismanagement? The multifactorial. Some patients might be uncomfortable in asking the providers questions. They just tucked away the prescription and never get it dispensed because they, first of all, didn't think they need the medication, but they didn't want to challenge the provider, the healthcare provider. Well, the patient might believe that I don't really know if all the medication is so good, and I believe in herbal supplement or other alternative medicine. Is the patient's belief in whether the medication will help them or not, and also the understanding, the reason why the medication was prescribed in the first place. That could be related to their health literacy. They could be low in health literacy and didn't really understand why the medication was prescribed and how to take them. High pill burden is also another barrier. When they have to take so many pills at different times of the day, they often get confused and miss some of them. Complexity of medication regimen. Yes, the more complex the regimen is, the more difficult it is for the people to follow, especially in elderly that might have some cognitive impairment. But even think of us as younger adults. If we have to take it multiple times, we likely will forget one or two of those times that we have to take them. And some medication require changes in regimen frequently. For example, people might be dosing insulin differently according to how much carb they eat and what is the blood sugar. If that change is often, then the individual has to be competent enough to really adjust the dose according to the parameter that was explained to them. This is one aspect of frequent changes. But another aspect is sometimes medications are changed because, for example, if the doctor finds the blood pressure was too high, he or she can just tell the patient. Sometimes the doctor would tell the patient, oh, instead of taking one of these, take 1.5. But there was never a written documentation. So if the patient did not remember or remember it incorrectly, a wrong dose can be taken. And also there are some medications required mastery of certain techniques. For people with diabetes, if one have to use insulin pen or doing blood sugar check, then the person has to know how to use the insulin pen correctly or how to use the blood sugar meter correctly. And for Anna, she has to use the puffers. The puffers, there are many on the market, and all of them require special training to understand how to use them correctly. And many people do not use the puffers correctly, and she's one of them. And also people find that when they take medication, they feel unpleasant side effects. Some of them they notice right away, such as drowsiness or constipation, and some upset their stomach, or they just couldn't sleep, or they feel like they're sleepy all the time. So all these unpleasant side effects, they related to the medication and concluded they shouldn't continue. In other incidences where the therapy has to last for extended period of time, if people started to feel better and they say, why do I need to complete the regimen? I'm already feeling better. One common scenario is people taking antibiotics. If they're prescribed for 10 days, if they start feeling better after 3 days, they say, I don't need the rest of the 7. I can save it for another time. Also, there's a situation where the patient did not see the immediate benefit of the therapy, and they start questioning the reason why they're on it in the first place. Anna did that because she didn't feel immediately better after taking the antidepressant, so she stopped it. Medication with social stigma, especially those that treat mental health conditions. People dislike taking them, and they also don't want people to know that they're taking them. So they want to get themselves off those medications because they really believe that I can be stronger and I don't need the medication. And lastly, maybe not the least, is the patient's forgetfulness. Some people have cognitive decline as a result of multifactorial factors. One of them is aging. The second could be medication-induced. Or a patient have had stroke. Those are the reasons, some of the common reasons for cognitive decline. And they might forget how to take the medication the way they should be. Well, look at Anna. She didn't manage her medication well, and many of those reasons apply to her. She didn't understand or believe it was important to take the blood pressure med because 2 is enough. Why 3? Too many pills. She's taking 20. She has to take medication 5 times a day. It's too complex. She didn't know how to use the COPD, the puffers, the 2 puffers, and each one of them, they require a different way of using them. And she felt some unpleasant side effect, like she took her diabetes medication and she felt dizzy one morning. And for her antidepressant, she didn't feel the immediate benefit, and she didn't really want to take it because it has a social stigma to it. So what is the impact of not managing medications? Well, if the medication is taken incorrectly, let's take a look. If the patient missed doses or have poor technique in administering the medication or did not complete the treatment regimen, that will result in inadequate medication in the body for the condition this is meant to treat. That will result in treatment failure. The second scenario is if the doses were taken at times that interact with food or other medications, or the doses are taken too early before or too late after the meal. Again, that also can result in not enough medication in the body and points to the direction of treatment failure. The third possibility is they misunderstood the direction and took too much. Well, that resulted in medication toxicity. For people with diabetes, if they took too much of the diabetes medication, that can result in hypoglycemia. And in elderly patients, that can lead to fall and fracture. So let's do the next polling question. So what are some possible consequences of missing doses or poor technique in administering medications? Check all the boxes, whichever one applies. Yes. Yep, symptoms of chronic illness not managed, such as shortness of breath and COPD in Anna's case. And people with asthma, if they don't know how to use the puffers, asthma flare-up. And if they're not using the insulin pen correctly, for example, the blood glucose could be too high, or if they miss the dose of the diabetes medication, that can result in blood glucose too high. Yep, hospitalization leading to crisis. If the COPD is, for example, the exacerbation of COPD, that's a very high burden disease. And undesirable adverse event from uncontrolled hypertension. Yes, stroke and heart attack. Thank you for agreeing with all these reasons. So, what do we know from studies about impact of medication non-adherence? Studies have shown that 30 to 50% of treatment failure and 125,000 deaths in the U.S. annually is caused by medication non-adherence. What about people that chose not to take the pill for the cholesterol because they really didn't notice any symptoms of high cholesterol or any changes after they stop it? Well, the non-adherence to statins increase the relative risk for mortality from anywhere from 12 to 25%. People with diabetes often take medications for the vascular protection. If people already had a cardiovascular event such as a stroke or a heart attack, if they're non-adherent to the cardioprotective medications, that would increase the risk of hospitalization related to cardiovascular event from 10 to 40%, and dying from such an event from 50 to 80%. What about people that don't take the medication for the heart failure? Again, that can also result in an increased number of visits to ER. So these are the costs to our healthcare system. What about for the patient themselves? If people are still productive in their work, still committed to a full-time job or working still, they will miss days of work or simply because they do not feel well and they're unavailable to their family and friends. And that all points to the direction of quality of life for themselves and also for their loved ones. So let's look at the other spectrum, the other end of the spectrum. What are some possible consequences of taking more than the prescribed doses? Yes, all those can be the result if the medication are taken incorrectly and too much were taken. So let's move on and talk about, now we know the severe impact of not taking the medication as prescribed. So what are the tips to manage medication? There's not a one-size-fits-all strategy for everybody. We need to customize the intervention to the individual. So the very critical step, the very first critical step is to understand the barrier, why the medication are not taken as they are. Once we understand the reason, then the individual can receive interventions to help to resolve those barriers. So I'm going to list some common barriers and the tips. Then for you or for the loved one that you support, find out why they're not taking their medications and pull some of those tips, and hopefully you can work with a healthcare professional and make changes to the medication regimen. So here are the common barriers listed on one side of the slide and the tips to resolve those barriers on the other side of the slide. So here we go. So in patients that don't believe or lack the understanding for the reason for taking the medication, or if they feel the medication has social stigma, or they have experienced unpleasant side effects, or they feel the duration of therapy was unnecessary, or they didn't see any immediate benefit of those therapy, if any of those barriers applied to the person you're supporting or to yourself, then considering doing the following. Impart knowledge on indication of the medication. The person needs to understand why they're taking the medication and empower the person to self-manage their condition. Talk about the risk of not taking the medication, the downside of not managing the medication, and also think about the benefit when the condition is well managed. So weighing the pros and the cons is a process that perhaps to help the person to see the reason and the benefit of continuing on the medication regimen. In situations where there's fears or concern, for example, people taking diabetes medication, if they are afraid that they might go low and fall or fracture, then first of all, talk about healthy eating. Look at the mealtime. There are many resources available on the CDA website. Talk about healthy eating, and have something put together how to manage low blood sugar when it happens. So the supplies can be all centralized in the location of inside the house, and the proper step to treat it is be clearly laid out so the person can understand, so that their fears and concern can be addressed. But the most critical step, if hypoglycemia happens, it is to look at the medication and the person's eating habit. Do they match? Maybe there's too much medication for what the person eats. So don't simply just treat it, but go back to what they're taking and when they're having low blood sugar, and discuss with the healthcare team to change the medication to suit the person's lifestyle. Okay. Second, what about if the medication schedule is too complicated? It's often the case. Many people believe they spread the medications out is better for the absorption, less interaction. On the contrary, very few medications are contraindicated to be taken together. There are some, but not too many. There are a lot of medication, most of the medication, they can be combined, and your pharmacist will be in the best position to help you. So if the regimen can be simplified and match the patient's activity of daily living, like such as mealtime or their the bedtime routine, that would help them to remember to take the medication. And also recommend taking all the medication at the same time of the day, not to vary. One day take the blood pressure pill in the morning, the next day at noon. Stick to the same time, and look at when are the best time in a person's daily activity schedule is to take medication, then work around that and develop or change the medication schedule. What about if there's a lot of pills the patient is taking? What can we do? Often, medication are prescribed and could be left that the patient is taking it forever and forever. We find that it's commonly a problem in elderly. They don't even remember the reason why they're taking them. So, work with the healthcare team. First, prepare a summary of all the current medications and how they are taken and what time. And work with a family doctor or the most responsible prescriber for that medication and ask for, should I continue? Do I need to continue taking this? A lot of the medication they need, but some they might not need. So it is to pick out the ones that you do not need and taper the dose and then stop it eventually. And if the frequency is too often and is difficult to remember, often there are long-acting preparations that can simplify the medication taking. And on the market, there are a lot of combination products that would have two medications combined in one pill. So again, that would be a strategy to reduce the number of pills the person has to take. What about in situations where frequent changes to regimen causes confusion and the medication not being taken properly? Work with the prescriber. Ask the doctor to write a new prescription every time a change is made. And that prescription should be forwarded to the pharmacy. Even though you might not need a new supply right away, but if the pharmacy has that new prescription, next time when it's dispensed, the label will reflect the change. And try to use one pharmacy to centralize all your prescription dispensing, because in this way, they can track the changes. Next barrier. In patients who is living alone or have some cognitive impairment, that they're unable to organize the medication for the daily taking. So there are compliance packages and adherence aid that one can consider. One of them is called a Blister Pack, the one that's showing the red pill down the column. So that can be prepared by the pharmacy once the schedule is worked out. So this way, the patient just have to remember punching out the proper bubble at the proper time to take the medication instead of counting how many pills they have to take out from the vial. And some family likes to support their loved one by organizing the medication in pill boxes. So these adherence aids are very inexpensive. You can get them in dollar store or the local pharmacy, they all have that. And you can organize the medications. And also an advantage, if you go out, you have to travel, like going to someone's house, staying overnight, then you can simply take the pill box with you and your medication is right there instead of bringing the whole bag of medication. Now, let's look at how did we help Anna? The previous slide that we showed a few minutes ago, Anna was taking about 20 medications and spread out 5 times during the day. So after consulting with the doctor and working with the pharmacist, so here are the changes, and I have summarized them here for you. So for her diabetes medication, the first one, because she was feeling dizzy, so the number of pills was reduced. And for the second diabetes pill, which the one that she has to take multiple times of the day, a long-acting preparation was chosen, so she only had 1 pill a day. For her blood pressure med, number 1, she was taking it at lunchtime, and remember that time slot is where she often forgets. So we moved it to the breakfast. She'll take it at breakfast, and so is blood pressure number 2, and blood pressure number 3 is unchanged. It's at bedtime, because Anna said, well, I most likely will remember if I were to take it at breakfast and bedtime. This is what we work with. And the cholesterol pill, it was being taken at lunch, and we moved it to the bedtime because it's the best time to take it. And the breast cancer pill, we moved it from supper to breakfast. Osteoporosis pill. This is the one she takes once weekly, And it was the one she was taking required her to take it on an empty stomach and remain upright for 30 minutes. Because she's unable to remember to do it before breakfast, so a different formulation was chosen. So this one, she can take it on a full stomach, so after she takes breakfast. Calcium and vitamin. She was taking too many. She also had some dairy products in her nutrition, so she did not need 2 calcium pills. So that was reduced from 2 to 1. That was moved to bedtime for 2 reasons. One, the calcium can interact with the osteoporosis pill and also her thyroid medication. So by moving it to bedtime, she would have the full benefit of the osteoporosis pill and the thyroid medication. What about the depression pill? She's supposed to take it at lunch, and that was a problematic time for her. So we moved it to the bedtime. And in fact, that also helped her to sleep. Some antidepressants actually help people to sleep. So that was getting 2 birds with 1 stone. The pill for acid suppression. She has some gastric reflux, but it's no longer a problem. So that medication was tapered and finally discontinued after 1 month. To manage her COPD, the puffers are the mainstay of therapy. So education was provided for her to understand, so she understands the preventers. The 2 medications she takes daily are very important. The blue one is only when she's short of breath as a rescue. So she was taught the technique to use these 2 puffers correctly. And lastly, the thyroid pill, we left it at breakfast time. So what we did was reduce her pill burden from 20 pills a day to 14. And the medication regimen was simplified to twice a day instead of spread out 5 times a day. So working with the medication regimen is very important. So where do we get help to do that? People with diabetes can go to the diabetes care team and talk about the medications because they often have physicians on board. And also in some region of the country, we have complex care diabetes centers. So they're staffed with nurse, dietitian, and pharmacist and social worker. They can also help the patients streamline their diabetes, their medication regimen. Of course, the family physician is the hub of the care, so he or she can definitely be a very helpful person to simplify the regimen. Also, throughout our country, the pharmacists have been doing medication review to at least provide a list and also resolve some of the medication-related issues. And they would be able to assist you to choose times to take the medication so there's no interactions. And also in some parts of the country, they are also doing dedicated visits to help people with diabetes to manage not just the diabetes pills, but all the other chronic health conditions to optimize their health. So you can also utilize the pharmacist to talk about other comorbidities if you have diabetes. And the growing trend is also have pharmacists do home visits. So you can talk to your local pharmacy and see if they can provide such a service if the person you're supporting is unable to go to the pharmacy. And lastly, if you would like to have some tools on your fingertips to perhaps organize the medication or understand more about what you can do, you can actually look at these 2 websites, the American Heart Association, and also the second reference here is the 12 medication management tips that may save your life, and just look at some of those tips there. That would be helpful. So in conclusion, we have talked about strategies to optimize medication taking, and I thank you for the time and attention. So I can now open for questions.
Thank you so much, Freda, for both developing and delivering such a great presentation on managing medications. Just based on some of the comments that are coming in, it's been a really, really great learning experience, and participants are really grateful for the tips that you've provided. So we just want to thank you for that. We're going to start the question period now, so for those of you who haven't done so, please type your questions into the question pod. Again, that's the bottom right-hand section of your screen. And please note that we do have quite a few questions I see that have come in, so if we don't get a chance to respond to them through this webinar live, then please email us at webinars@diabetes.ca, and we'll get back to you as soon as possible. So with that being said, Freda, we'll start with our first question here. One of our participants has asked, I take 4 metformin pills each day, along with other pills, 2 before breakfast and 2 before dinner. In your recommendation, is that the best way?
If you're taking the metformin before meals, and it's a good way to take it. You often, with medication, there's not one way to take it. There are more than one correct way to do it. In people that can remember to take the medications, often before meal is usually the time that they remember to take it. In some people, they take metformin and they have an upset stomach and just, not comfortable. Then we often recommend they can take metformin after they eat. So for metformin, you can take it before the meal if it doesn't upset your stomach. But if you feel that you feel bloated or you get cramps or you feel uncomfortable, then you can take metformin after you eat, immediately after the meal.
Great. Thank you so much for that response, Freda. Our next participant has asked, are there some foods that may interact with typical diabetes medication that perhaps we should stay away from?
Actually, for food, there isn't. You'll be mindful, of course, the food has, if they're grain products or food that contain carbohydrate, that would increase your blood sugar. But we all need carbohydrate as part of a healthy diet. So as far as food is concerned, I do not think there is any type of food that's contraindicated. Often in the past, we say don't take grapefruit juice or grapefruit, because it potentially can interact with statin medications. But as far as I know, for diabetes medication, there is not a type of food that you can stay away from. It's all about healthy eating, having varieties, and eating meals regularly at regular times.
Great. Thank you for that, Freda. Also in relation to that question, we have had a couple different participants ask with regards to perhaps negative consequences of particular vitamins, as well as herbal supplements such as cranberry capsules or vitamin D or B12. Is there anything there that we should be concerned about in terms of interactions with diabetes medications?
So, okay, can you is it vitamin D and B12 and what else? Herbal supplement?
Yes.
Okay, so let's start with herbal supplements. People often feel that if they take herbal supplements, they're natural, that can really help them improve their health. And I take a neutral position on taking herbal supplements. Provided that you take herbal supplements and do not discontinue your prescribed medication, you can monitor the response of any adverse effect on your health and your chronic conditions. So, for example, if you're taking some medication claimed to be very helpful in managing diabetes, then you can do that if you really strongly feel so, because that really means that you want to take charge of your health. When you start a herbal supplement, I strongly advise the person do more frequent blood sugar monitoring, but do not stop your regular diabetes medications. Some herbal medication may enhance your diabetes medication, may have a little bit of a positive impact in lowering blood sugar, and if that's the case, then you do want to know the extent of the impact. And if you continue to take the herbal supplement and notice that your blood sugar is trending lower, being consistent with your dietary intake, so it's a time to review with your diabetes care team how to adjust your diabetes medications. But do not stop taking your diabetes medication thinking that the herbal medication will help. I have seen people that take herbal medications for their blood pressure control and stopped the prescribed antihypertensive medications and resulted in a stroke. So you do not want those adverse outcomes. So first of all, with herbal medications, because it's hard to know what is in there, the regulation on the quality control is much lower and less intense compared to prescription medications. So we really don't know, and often the herbal supplements have several ingredients in it, and you really don't know how it impacts your chronic health condition. So do more monitoring if you do want to take it. If it's supposed to lower your blood pressure, monitor your blood pressure. If it's supposed to lower your blood sugar, monitor your blood sugar. Okay? So we'll leave the herbal supplement now. So let's come to talk about the vitamins. Vitamin D is a very, very good vitamin. And in North America, we do not get enough sun, and our skin does not make enough vitamin D. So taking vitamin D, 1,000 units per day, is a good step to enhance your bone health and the muscle strength. So because it would help the absorption of calcium. Okay, vitamin D is a good supplement to take. What about vitamin B12? In people that have a healthy diet, younger adults, they may not need vitamin B12. But in people that takes metformin, sometimes metformin can cause a lower level of vitamin B12. So you may be able to, when you do your health checkup annually, talk to your doctor, and look. They'll look at the cell count, and will let you know if you're at risk of anemia induced by low vitamin B12. Now this is for younger adults. For older adults, vitamin B12 is very important to maintain the cognition. So if they're on on metformin and they're elderly, it is a good idea to check out the vitamin B12 level and receive supplement if they're low. Okay, so the next question.
Thanks so much for that, Freda. That was a great response. Our next participant has asked, how often should a medication review be done? Once a year or at each visit when the patient sees their doctor? Do you have a recommendation around that?
It's not a one-size-fits-all. It would depend on how many medications you're on, and are you still having that chronic condition that need to be managed. So some chronic condition, they improved and the dose can be reduced, but some of them, they stay the same. They would need exactly the same medications. So for example, for blood pressure, so you can monitor your own blood pressure and see from the medication that you're taking for hypertension, where is your blood pressure? So are they at target? Are they too low? Are they too high? So you feel that if you notice that your blood pressure is too low, then the blood pressure medication need to be adjusted. And likewise, if you notice your blood pressure is above target, yes, then the review is necessary. And also, are you feeling anything, are you feeling some adverse, maybe some side effect that's unpleasant, maybe is caused by the medication, then think about looking at the medication, whether you need to continue, but don't stop it without talking to the prescriber. So it will depend on whether you notice anything unusual, or ask yourself whether the medication intended to treat your condition. Has the condition improved to the point that you do not need the medication? For example, people that have depression, they feel better. Does it mean that they should stop taking the medication? Yes or no, depends. Sometimes they would need the treatment for an extended period of time, and then they can stop it. But if they have had exacerbation of the depression, they might need to take it for longer periods of time. So it all depends. And work with your pharmacist, and at your annual checkup, it would be a really good idea to bring a list of the medication and compare to the list that your doctor has. Are they the same? or the dose is the same, the type the same, how you take it is the same, and ask him or her to look at, should I continue taking all these medications? Do I need them all? So that would be a good time. But if you notice anything unusual, then do the check, the review more often. But I guess once a year with your family doctor would be a good step to start.
Great. Thank you so much for that response, Freda. Folks, we just have maybe a couple more minutes left for questions. So just a reminder for the questions we didn't get to, please feel free to email us at webinars@diabetes.ca. Our next participant here has asked, they're a healthcare professional and they're wondering if there is a reference that's available that you could recommend where they could check interactions between medications and natural health supplements.
This is very difficult because the natural health supplements are such a variety of ingredients and the process they are made. It is very, very difficult to check the interaction. There are some obvious ones, and your pharmacist would have that, resources to look at it. However, coming back to the same, as the previous question that I provided the response to, if you're taking the natural health supplement, monitor the chronic condition that is supposed to be helping and see if there are changes. And if your condition improved, maybe it's the credit of that health supplement, maybe it's not. Maybe you're taking a healthier lifestyle. But nevertheless, if your blood sugar starts improving, you might not need so much diabetes medication, then work with your diabetes care team. But having one reference to check the interaction is almost impossible because the natural health supplement, there's so many of them out there, and even with a name, sometimes we really have difficulty knowing the exact ingredient, the active ingredient in the herbal supplement. So you read between my lines is, stay active, have a healthy lifestyle, eat a balanced meal. The herbal supplement, I take a neutral view on it. But often is costly and the benefit is doubtful. And I also have seen patients that come in with bags and bags of new supplements to the point that their appetite is very poor because their stomach is full of these supplements. So eating a healthy diet, a balanced meal, I think it provides a lot more nutritional support and benefit to our body than these supplements. So this is my position.
Great. Thank you so much for that, Freda. And our last question here that we'll take for the afternoon today is, if metformin is not taken until an hour or two after a meal, does this alter the medication's effectiveness?
Not really. You would like to be consistent in taking the metformin. Actually, metformin, if you think of it, often is taken 2 times. So the middle meal, you don't really get a dose. So we like to be consistent in the time you take it, and most people would remember to take it before a meal or right after the meal. If you take it 1 hour or 2 hours after, it becomes a variable. If you change the meal time and the 2 hours come by, you might forget. So taking it before or after a meal immediately would be a much easier way to remember. But as far as the medication is concerned, I don't think it will really alter the effectiveness of the medication. Just be consistent in when you take it.
Great. Thank you so much, Freda. That does conclude our webinar for today, folks. I'd sincerely like to thank Freda for speaking on behalf of the Canadian Diabetes Association. It has truly been a really great learning experience. Just want to remind everyone that our webinar today will be online and available in the coming weeks. So if you'd like to listen to it again, or if there's parts of it that you may have missed, please feel free to come check us out at diabetes.ca/webinars. And for the rest of our series, we do have 4 more webinars that are coming up. Our next one next week is on portion control. The following week, we'll be doing one on exercise. The following week after that, it'll be on your eyes. And we'll finally end off the series in October on diabetes research and new advancements that are happening in the field. So we do hope that you'll come by and visit us and participate in our webinars coming up in this series. We look forward to your participation. For those of you that are in the BC area, we are having a free CDA Expo, and that's going to be in Victoria on September the 24th. And this event is for all people that are affected by diabetes. So if you'd like some more information and to register, please visit www.diabetes.ca/expo. And for those of you who are unaware, the CDA has developed the Canadian Guide to Living Well with Diabetes. So inside the guide, you'll actually find the most up-to-date information that will help people living with diabetes to understand the disease and how to effectively manage it. So visit orders.diabetes.ca for your copy today. And for those of you looking for more support and resources to live well with diabetes, feel free to call our toll-free line. That's 1-800-BANTING. So that's 1-800-226-8464. Thanks once again for joining us today. We hope you've enjoyed learning with the CDA, and we look forward to your participation in the future.